Well, around this time every year, preparations begin for the flu season. But as you're well aware, things are a lot different this year. Meg Terrell tells us that the vaccine makers are preparing for a record year.
The four major makers of flu shots together say they plan to supply almost 200 million doses of vaccine to the U.S., up from about 170 million last season.
This is about 15% more vaccine than we've ever produced before. Both the public and private demand for this upcoming season has been tremendous.
Fewer than half of American adults and about 60% of kids typically get the flu shot each year. Now, public health officials say they plan an even greater push for vaccination this year amid the COVID-19 pandemic.
In a system where some states, some localities have their hospital systems taxed to the maximum, the last thing we want on top of that now is to have beds that could go to COVID patients be used for influenza patients. Ventilators that may be needed for COVID patients now have to be also diverted to influenza.
Every year, the flu sickens between 9 million and 45 million Americans, causes at least 140,000 hospitalizations, and leads to between 12,000 and 61,000 deaths. The flu shot isn't perfect, ranging from 20 to 60% effectiveness each season, depending how well scientists predict which strains will be circulating. But the CDC says the vaccine still prevents millions of illnesses and thousands of hospitalizations and deaths from flu each year.
It protects us, and if we don't get sick, we don't spread it to other people. Influenza vaccination has also been shown to lessen the severity of illness.
And guys, experts say we saw routine vaccinations and doctors' visits, of course, plummet during the shutdown in the U.S. They are hopeful those are climbing back, and they are encouraging us to do everything we can to protect ourselves this fall.
You know, Meg, I can see the demand for the vaccine coming higher as people want to protect themselves from a possible influenza. But I wonder if some of the precautions we're taking to ward off COVID might mean that we would have a milder than average flu season, since we're already socially distancing and wearing masks and doing things like that.
It's definitely possible and something public health officials hope will happen. And I actually asked Dr. Fauci about this earlier today during a media briefing, and here's what he told me.
My hope is that both of those will be down, that vaccination for flu, public health measures for flu and COVID would have us be in the situation where both the flu season is blunted and we have very little COVID.
But of course, guys, that depends on all of us taking these steps to protect ourselves and, of course, each other.